I'm Kim Delahunt, President and CEO at Headwaters Healthcare Center. Yeah, there's lots to be proud of that we achieved over the last year at Headwaters Healthcare Center, beginning with one of our biggest achievements was the successful completion of our accreditation. We actually achieved accreditation with exemplary standing from Accreditation Canada, and this consisted of a week-long survey where we had a few surveyors come on site and look at all aspects of the hospital, all of our procedures, all of our policies to ensure we had ample quality monitoring in place. So it was a really big achievement for us. In addition, there was lots of other upgrades that we were able to implement across the hospital, including a new X-ray, a new CT machine. We also continue to implement initiatives in our new clinical priorities plan, which I'm really pleased to elaborate on. Some of our accomplishments there were that we were able to recruit our very first geriatrician to the hospital, who is now offering programs and services to support the seniors that need care in our communities. In our emergency department, we continue to focus on our wait times. We have an emergency department wait time clock that you can see online or within the department to ensure transparency and just to help with planning for time. We also re-implemented a new pediatric urgent care clinic, and we have a full roster of pediatricians here at the hospital. We also continue to plan for our obstetrics and all the moms and babies that are delivering here at Headwaters. We have a very robust 24-hour on-call physician model in place where there's always an obstetrician available. And lastly, we also continue to focus on supporting those individuals that come into our hospital and emergency department in a crisis, whether it's mental health and or addictions. We were able to now recruit a psychiatrist who comes on site 2 nights a week initially to support that patient population, which is really beneficial. Yeah, we're really excited to have launched our new strategic plan this past April. I'm really pleased that our vision has stayed the same, and our vision is one community caring together. And what's new in this strategic plan is now we have a purpose, and our purpose at Headwaters is to provide excellent care close to home. In addition, we have our values of kindness, accountability, respect, and teamwork. I'm really happy that we have the values of kindness, accountability, respect, and teamwork, and a couple of those stayed the same from our last strategic plan, which shows that they resonated with our staff and physicians and volunteers, and that we were on the right track. In addition, we have some fundamental commitments in this new strategic plan. We are committed to ensuring diversity, equity, and inclusion. Of course, we're committed to enhancing and embracing all of the digital technology advances and AI, and always ensuring a safe and healthy workplace for all of our staff, physicians, and volunteers. Our strategic plan was the result of close to 3,000 individual inputs from patients, families, community members, community partners, of course our staff, physicians, and volunteers. And I'm really pleased that our entire board was a part of the steering committee that oversaw the development and creation of this new strategic plan. So it's really a culmination of a multitude of efforts and some continuation from our previous strategic plan, which just shows that we were on the right track and we continue to be on the right track, building a very bright future for Headwaters. Yeah, we've been really fortunate over the last couple of months to have been able to announce some really big advancements to support our hospital. The first one is that we had our official groundbreaking for our new MRI that's slated to start doing scans next spring. So we had that groundbreaking, which is very exciting. So the work is now in full swing to bring a new MRI to support all the patients and families across Dufferin-Caledon. In addition, last week we were able to launch our very new and expanded hemodialysis program. So that was very exciting. We were able to have a patient member speak about their involvement in the development of that new space. It's very patient and family friendly, and we can now offer more service to dialysis patients, again across Dufferin-Caledon. We also, this past year, opened up a new X-ray room, fully renovated, and we also installed a brand new replacement CT scanner. So there's lots of exciting things happening at Headwaters and more to come. Yeah, so we're doing a lot of planning for the hospital to ensure that we're ready to support the population growth over the next 20 years, as it is significant. So we are in the process of updating our master plan and program for the hospital. The last time this was done at Headwaters was over 18 years ago. So we're happy that we're going to be creating our next master program and plan to guide us for the next 20 years. And what this involves is looking at all of the population growth that is expected across all of the communities that we serve. We also took a look at all of our current programs and services and what the wait times are, what the demand is for those. Again, we received input from all of our partners, physicians, staff. We looked at provincially, where is the province headed, what is happening within AI and the digital space. And then we brought in architects to support all of that population projections and planning, who are now helping us design what that expansion will look like for the hospital in a phased approach over the next 20 years, as it is significant. But ultimately, this is going to be our roadmap for the next 20 years. So we're really excited, and we're going to be happy to share this over the coming months. What am I most excited about? That is an excellent question. There is a lot that I'm excited about. Really though, I think it's the growth that's being planned for in the future at Headwaters Healthcare Centre, because it is going to be significant, and we are ensuring that we have the plans in place to continue to provide high quality care close to home, and we're going to be able to do that with expanded space, expanded programs and services. And honestly, this is what I'm most excited about, as we are just an amazing hospital. And one last thing that I would be remiss if I didn't mention is that I'm also really excited about some new partnerships that we have. And we do have a new one with the Toronto Metropolitan University School of Medicine. So we'll be welcoming even more medical students and residents next fall, which is really exciting. So together with our partners and with all of the growth that is coming, it is a very exciting future for Headwaters. Yeah, we could not do what we do at Headwaters without the generous support of our community and donors and our partners in our foundation office. A lot of the expansions and the growth and all of the new equipment that comes to Headwaters is via generous donations from donors in the community. So we're very grateful to have big fundraising events like the annual gala. We recently had our first hike for cancer to support breast cancer, which was amazing. And there are other initiatives that the foundation has, including we're in the midst of the largest campaign ever in Headwaters history, the Smart Headwaters campaign, which is supporting us bringing our very first MRI to the hospital and many other pieces of equipment. And so honestly, we could not do that without the support of our community, the generous donations, and again, our foundation partners. So I definitely want to extend a big welcome of thanks to everyone in the community. So I certainly want to express my sincere gratitude and thanks to all of our volunteers that come from our communities, to the community itself for always supporting us, whether it's through donations, through support. We are here to support the community, and our doors are always open, and please don't ever be afraid to come to the hospital if you need help. And thank you for your continuing partnership and support of the hospital.